Well, it's both a pleasure and an honor to be here. I want to thank Steve for inviting me and the Hippocrates Institute. A couple things. He did, the way it's scheduled is sort of breaking this talk into two parts, so part of it's today, and I know there's panels tonight and a second part tomorrow. But here's really the scope of these two talks. One is to look really closely about what we know about mental disorders, and do they fix chemical imbalances in the brain, and how those drugs affect the brain. That's part of it. And is it different than what we're told? And then the second part of it is looking about how these medications affect long-term outcomes. So how does it affect us and our ability to function, the course of these disorders, which we take them for, over the course of 2, 5, and 10 years, which is a very different question as to why drugs get approved by the FDA. So just looking at the long-term effects. And we'll do that for antidepressants today and antipsychotics and stimulants for kids tomorrow. Just one thing that Steve was mentioning. So most of your speakers at the conference are doctors, they're medical doctors, or PhD. I come at this as a journalist. So I've been writing about medicine and science in different forums for a long time, newspapers, magazines. And I think it's important to note I initially had a completely conventional understanding of psychiatry and its medications, which my understanding was we were making great progress in understanding the biology of mental disorders, and that we now had drugs that fix the chemical imbalances that cause those mental disorders, like diabetes for insulin. And if you hear that metaphor tells of a fantastic advanced medical advance. It means you've identified the pathology, and now you have a treatment for that pathology. And if you go through the history of medicine, that's generally when you make great leaps forward, when you identify the pathology and you get a specific antidote. And in fact, in 1998, I co-wrote a series for the Boston Globe, that was mentioned, on abuses of psychiatric patients in research settings. And one of the things we looked at were studies where they had withdrawn antipsychotic medications from patients diagnosed with schizophrenia. We said that was unethical because the drugs were like insulin for diabetes. They fixed a dopamine imbalance in the brain. And we said you would never withdraw insulin from a diabetic, at least in mainstream medicine. So why would you do studies where you withdrew antipsychotics from schizophrenia patients? I mention this just to say I started out with completely conventional understanding of psychiatry, what was going on, and that's a story of great progress. Real quickly, these two different books. The first book, which was published in 2010, Anatomy of an Epidemic, of these two books I'll really be talking about, that's the book that really looks at the long-term outcomes for people diagnosed with schizophrenia and treated with medications, or diagnosed with depression and treated with antidepressants. And just one of the things here is we as a society have really embraced the use of psychiatric drugs, especially since the arrival of Prozac in 1987. In 1987, we as a society were spending about $800 million on psychiatric drugs. Today we're spending about $40 billion a year in the United States on psychiatric drugs. That's a 50-fold increase. And as that has happened, all the markers of the burden of mental illness in our society have exploded, upwards, increased. And one of the ways I look at Anatomy of an Epidemic is the number of people on disability in the United States receiving a government payment, SSI or SSDI, due to mental illness. That's why they get declared eligible. In 1987, we had about 1.25 million people on disability due to mental illness receiving one of those government payments. Today, we have about 5 million people. So during this time when we've really embraced the use of psychiatric disorders rather than decrease the burden, you see this remarkable increase. How about kids? It's really since 1980s we began medicating kids quite a bit, ADHD, then juvenile bipolar disorder, etc. In 1987, there were 16,200 children in the United States receiving a disability payment or their families due to mental illness. Any idea how many today? It's about 750,000. So during this time when we've begun medicating kids, we're seeing rising burdens of mental illness. So that's sort of a conundrum I explore in Anatomy of an Epidemic, and what I look at is, what is science telling us about how these medications affect us over the long term? And I'll have some of that data today and then some of it in the presentation tomorrow. Now this new book that just came out, I actually co-wrote this, and this came out of, I was a fellow at Harvard at the Safra Center for Ethics, and they set up a lab to study institutional corruption in society. So how do institutions with a public mission, like Congress, which is supposed to serve the people, or a medical specialty like psychiatry, which is supposed to serve patients, are there influences on that institution that corrupt their behavior? And what we look at in this book is two corrupting influences, and I'll talk a little bit about this today as well as we go through the chemical imbalance story, is the influence of pharma money to the APA, American Psychiatric Association, and to individual academic psychiatrists, and also guild interests. So psychiatry, of course, competes with patients with a lot of different professions, social workers, people offering alternative therapies, psychologists, and so they have a need to promote a certain story that helps get people into their offices and taking pills as well. And so we looked at how that story that is told to the public, in fact, is out of sync with their own underlying science. So this is a conference with the title, The Real Truth About Health. This book really is the real truth about psychiatry. What is its science actually showing? So let's go to, this is just how I'm going to break it down between the 2 days. We're going to go over the chemical imbalance story, why we came to believe in it, the scientific investigation of that story, then how psychiatric drugs actually change the brain, and then we'll look at the effect of antidepressants over the long term. That'll be today, and then tomorrow we'll do a little bit about this rise of the burden of mental illness, and then we'll look at the long-term effects of antipsychotics and stimulants on children. So, how did the public come to believe in this story, the low serotonin theory of depression? Well, if we go back to, and we've all seen this on our TVs, right? You turn on your TV and they say you don't have enough serotonin, you take the pill, your serotonin is balanced, and now you're no longer depressed, and you're walking on a beach with a beautiful woman, right? We've all seen that. Here's how this story came about. In 1980, the American Psychiatric Association published the 3rd edition of its Diagnostic and Statistical Manual. Now, in its first 2 editions, it basically had more of a psychological explanation for why people became depressed and anxious. There were Freudian theories, and there was the sense under Freudian theories was, you know, some of this happened because of unconscious urges, but there was an improper adjustment to there was an adjustment to your environment that led to stress, whether it be depression, anxiety, etc. But in the 1970s, psychiatry was coming under a lot of criticism. There was a sense that its talk therapies weren't any more effective than talk therapies by people who were much cheaper to go to. There was some question about the validity of these different disorders. You can read in psychiatric archives how the profession felt it was headed for extinction. There was so much criticism. And then, among themselves, they said, what is an image that a profession in our society that has such great prestige, such legitimacy? And they said, of course, the medical profession, the white coat. So part of what they do when they publish the DSM-3 is they want to have, quote, a medical model that tells to the public that these are diseases of the brain, and once you have diseases of the brain, who do you go to? You go to doctors who can prescribe drugs. So my point is, a lot of the reason for this DSM-3, they're now going to reconceptualize depression as a disease of the brain, and not something that happens to people because they lose jobs or they get divorced or they suffer all the setbacks. They're going to locate all distress now in the individual, in the brain, and they're going to start calling these things diseases of the brain, things depression, kids who aren't behaving right in school, anxiety, etc. And once they reconceptualize it this way, of course, the drug companies are happy because you can get drugs approved for market for diseases. You can't get them approved for market for neurotic disorders. So this is a big switch. And now they're going to start selling this disease model to the American public. And by the way, the minute this book is published, they start forming PR campaigns. They start training their own psychiatrists what to say to the press. They start courting the press, they hire PR people, and so this is the moment they're going to sell a new story to the American public about the basic nature of psychiatric disorders. And you see right away, now I'm just going to show you how there's been this constant drumbeat within comments to the public about how these drugs fix chemical imbalances in the brain. And remember, if this is so, if you have depression because you have low serotonin, and the drug fixes that, that's a story psychiatry is telling us of a great advance. And it is saying that its new conception of mental disorders as diseases of the brain is correct. It's been validated by science. That's what this story is telling us. So we go here, we can just do this. 1981, researchers believe clinical depression is caused by chemical imbalance in the brain. This is Associated Press. Now in 1984, who's Nancy Andreasen? She's going to be, after this, the editor-in-chief of the American Journal of Psychiatry. She's going to be one of the most important people in American psychiatry for 20 years as that position. This book also signals a sea change in our society as it becomes a best-selling book, and you can now start charting after this newspapers and magazines saying, we've discovered that these emotional problems are due to a broken brain. It's the individual's problem. Something's wrong with the brain. And what does she say? There are many hints that mental illness is due to chemical imbalances in the brain, and that treatment involves correcting these chemical imbalances. So 4 years after adopting this model, we're now starting to hear about these great advances. 1987, the FDA approves Prozac for marketing, for sale. Prozac is known as a selective serotonin reuptake inhibitor. So the image presented to the society is this. And we'll go into this a bit more. Depression is caused by low serotonin, by inhibiting its uptake from that synaptic cleft between neurons. You elevate serotonergic activity in the brain. That fixes that problem. And this story goes out, and the story is we're curing depression. But it's also a story, think about this. You can't just take this pill now for a little while and come off of it because you have something like diabetes. You now have to take that pill forever. You see what a great marketing thing that is? They take a person now who has a problem, some depressive episode, and they turn him into a lifelong patient with this story. And now it's after this we have direct-to-consumer marketing, and of course you start seeing your TV ads about how wonders of these drugs curing people. And you also see things in 60 Minutes about how people are cured of depression by this. Time magazine runs a study that says these drugs cure 70% of depressed patients immediately and 90% cured over the long term. Now that cured means you're fixing something biological. And you'll see this. Antidepressants restore the chemical imbalance scientists have linked to many depressions. This is a former president of the APA in an interview with a Florida newspaper. Just keep going. And look who I'm quoting here. I'm tracing statements by the heads of the American Psychiatric Association or statements by like the editor-in-chief of the American Journal of Psychiatry. These are not outliers. These are the people we look to in the United States for telling us the truth about what's going on. So Richard Harding, we now know, we're not supposing, we know that mental illnesses are not moral weaknesses or imagined, but real diseases caused by abnormalities of brain structure and imbalance of chemicals in the brain. We know this. 2001, antidepressants restore brain chemistry to normal. She's a future president. 2005, the American Psychiatric Association surveys the American public, and they have good news to report. 75% of people now understand that mental illnesses are usually caused by a chemical imbalance in the brain. This is good news. And then they send out, after doing this press release, after this survey, a press release, and they say a psychiatrist is a specialist specifically trained to diagnose and treat chemical imbalances. So they're saying we are the experts in fixing brain chemistry. You'll see this. They now issue a Let's Talk About Depression brochure. Antidepressants may be prescribed to correct imbalances in the levels of chemicals in the brain. And then I just went to some recent websites. These are things where you go on the internet, and these come with, by the way, if you go into the scientific advisory councils of these different groups, they are filled with the leading psychiatrists in America in mood disorders, presidents of the APA, etc. What do they tell us? Antidepressant medications work to restore proper chemical balance in the brain. Depression is caused by a chemical imbalance in the brain. And the National Alliance of Mental Illness research has shown that imbalance in neurotransmitters like serotonin, dopamine, and norepinephrine can be corrected with antidepressants. So you see in this line of quotations since 1980, 30 years of telling us of a simple fact. We know that depression is caused by low serotonin, and the drugs fix it. It's a story of a great advance, and something like It's antidepressants, I think, are the #1 prescribed drug in America today, and something like 25% of all women between 20 and 55 now take an antidepressant on a daily basis, and something like, let's see if I can get this right, 13% of all mothers now take an antidepressant while pregnant. So we want to see a little bit about how that may affect things as well. So, now let's just go and see if science supports this story. Is psychiatry being honest with us as they tell us this powerful story? Real quickly, how do neurons communicate in the brain? And this is just a diagram you can pull from anywhere, a medical textbook. You have a presynaptic neuron that releases that chemical, that neurotransmitter like serotonin, into the tiny gap between neurons, which we call the synaptic cleft. Those molecules, the serotonergic molecules or dopaminergic, they bind, we say, they bind with receptors on the receiving neuron, which is called the postsynaptic neuron. And you've probably all heard this metaphor. They fit like a key into a lock, right? And when that happens, that's how a message is passed from one neuron to the next. Right? Just basic. Now, how did the chemical imbalance theory of mental disorders arise? It arose not from an understanding of what was happening in depressed patients or people with psychosis. It arises in the 1960s, from an understanding of how the drugs act on the brain. So if we go back to here, imagine this. So you have that serotonin that is released into the synaptic cleft, right? Now the brain has to have a way to remove that serotonin to end the message, to have this crisp signaling system. Does that make sense? And that serotonin is removed from that gap in one of two ways. Either it goes back into the presynaptic neuron via reuptake channels, that's one way, or an enzyme comes along, metabolizes that serotonin, and those metabolites are carted off as waste, okay? And what researchers found in the 1960s, that the two antidepressants at the time, tricyclic antidepressants and monoamine oxidase inhibitors, they both inhibited that removal of serotonin from the synaptic cleft. Tricyclics did it by blocking the reuptake channels, okay? Monoamine oxidase inhibitors inhibited the enzyme that metabolizes serotonin. So for both ways, although by different mechanisms, you kept serotonin in the synaptic cleft longer than normal. So researchers said this: if we're upping serotonergic activity, and they were also upping norepinephrine, maybe the cause of depression, it's a hypothesis, is that people with depression have low serotonin. So the chemical imbalance theory of mental disorders arises from an understanding of how drugs act on the brain, and researchers hypothesizing the opposite is the problem, okay? But it doesn't arise from investigations into people with depression or schizophrenia. So now, what do we have to do? We have to see, do people with depression have low serotonin before they go on the drugs? Now, this is just for various reasons, they begin focusing on serotonin rather than norepinephrine, and this is just looking how an SSRI, selective serotonin reuptake inhibitor, blocks the removal. What happens is that drug sits in the reuptake channel, and therefore you can no longer remove it. So, they began doing this even before Prozac comes to market, and they give, they don't give people an SSRI before they do this initially. What do? What is the science to try to check with people to see if they have low serotonin before they're medicated? Well, they know this. So you release the serotonin, then normally it's broken down into metabolites, and so they say we can measure the level of metabolites in the cerebrospinal fluid. And if people have low serotonin, then they should have low amounts of metabolites in that cerebrospinal fluid. You see the indirect measurement? So they run such a study in the 1980s, and what they find is those metabolite levels are perfectly normal. Now, they do fall along a bell curve. There's some at a low end and there's some at a high end, but then you do the same thing with, quote, normal people, and you see the same bell curve. And then they also looked like, well, maybe the people who respond to antidepressants are those at the low end of the bell curve, and their serotonin is being fixed by the drug. And what they found, then when they put these people on medication, there was no correlation between response to the drug and your metabolite levels. So in 1984, the NIMH says it doesn't look like a problem in the serotonergic system is associated with depression. This in 1984 is the beginning of the collapse of the low serotonin theory of depression, 3 years before Prozac is brought to market. Okay? Now, after Prozac is brought to market, they keep on researching this, and they keep on trying to find, is there something wrong with the serotonergic system? Okay, maybe the problem is, okay, it's not that the presynaptic neurons release too little serotonin. Maybe the problem is those postsynaptic receptor neurons have too few receptors for the drug. Maybe that's the abnormality. But they don't find it. Now, here is something from the American Psychiatric Association's own textbook in 1999 that sums up this long search for a chemical imbalance in depression. And so what do they say to themselves? It says it was first the monoamine hypothesis is the low serotonin and low norepinephrine hypothesis, because these are both known as monoamines. First proposed in 1965. This is why the drugs work. However, watch this. Inferring neurotransmitter pathophysiology from an observed action of a class of medications on neurotransmitter activity is similar to concluding that because aspirin causes gastrointestinal bleeding, headaches are caused by too much blood loss, and the therapeutic action of aspirin in headaches involves blood loss. They're poking fun of the hypothesis, saying it was sort of silly from the beginning to just hypothesize that the problem is the opposite of what the drug does. Now, this is as they're telling you, you have low serotonin. This is in their own textbook. It says additional experience has not confirmed the monoamine depletion hypothesis. We're not finding it to be so. Who's Stephen Stahl? He is a molecular psychiatrist. He believes in the brain disorder concept. But then he reviews that in his textbook, Essential Psychopharmacology. There is no clear and convincing evidence that monoamine deficiency, that serotonergic deficiency, accounts for depression. That is, there is no real monoamine deficit. Who's Eric Nestler? I'm just showing you. He's considered one of the leading scientists in the world on neurotransmitter activity in general, and also how it might relate to cognition and psychiatric function. And what does he say? In 2010, we have looked at this in every way we can. We've depleted serotonin. We've looked at genetic associations. We've looked at all this. There is little evidence to implicate true deficits in any of these neurotransmitters in the pathophysiology of depression. And then again, he says, this is not a surprising finding because there's no reason that the mechanism of action of a treatment is the opposite of disease pathophysiology. So you're seeing again here, this hypothesis sort of had a false beginning, a false rationale. Who's Alan Fraser? Alan Fraser was one who was investigating this low serotonin theory of depression in the 1970s. Now this is starting to come out now, finally. I mean, I wrote about it I've written in both books before, Psychiatry and Influence, but what does he say? I don't think there's any convincing body of data that anybody has ever found that depression is associated to a significant extent with loss of serotonin. So you see how this has been going on now for 20 years? So real quickly, let's just go on the dopamine hypothesis. It's basically the same story. How do antipsychotics work? Now they block those receptors on the receiving neuron. Therefore, they act as a brake on dopaminergic activity in the brain. So researchers hypothesized maybe schizophrenia is due to too much dopamine activity in the brain, the same sort of thing. Did they find then that people with schizophrenia prior to being medicated had overactive dopamine systems as a matter of course? 1994, that was falling apart. Stephen Hyman, who's he? He's the former director of the NIMH. He's a neuroscientist at Harvard. What does he say? No compelling evidence. And this is this is coming out of Swedish researchers, and the important reason why it's from Sweden is actually Sweden scientists have a really vested interest in the dopamine theory because it was a Swedish scientist who first discovered how antipsychotics act on the brain. What does he say? Any simple exclusive pathology of the dopamine system was and is doubtful. Now, it is beginning, so here's some summaries of this long search. Who's Kenneth Kendler? One of the world-leading researchers in trying to find chemical imbalances, and he writes in 2005, "We have hunted for big, simple neurochemical explanations for psychiatric disorders and have not found them." Now, this last quote is my favorite quote. So there's a number of people now writing about how this story never panned out. As again, I wrote about it first in 2002 and then in 2010. And so what does Ronald Pi say? "In truth, the chemical imbalance notion was always a kind of urban legend, never a theory seriously propounded by well-informed psychiatrists." In fact, he says this whole story was promoted by enemies of psychiatry to make them look bad. I swear to God, if you read the whole quote. And all you have to do is go through that first group of quotes to show that this is nonsense. I mean, it's not nonsense in one way. They did know it was falling apart a long time ago. That's the truth of the matter. In fact, I was given a grand rounds at Massachusetts General Hospital after Anatomy of an Epidemic came out. And it was rather tense, as you might imagine, because actually a lot of the psychiatrists in the audience were people who've taken a lot of money from drug companies. And there was a rebuttal, and one of the people came up and said, "You know what? You used a straw man to make us look bad in that book. You said we tell people that they have chemical imbalances in the brain." And he said, that is an outdated model. We've known since the early 1980s that that wasn't so. That's what they said. And they were yelling at me for putting it in the book as if psychiatry had told people they had chemical imbalances. So I said to the audience, there was about 100 and 150 people, and I said, "You know what? You're right. You did know it was not true in the early 1980s, but I'm pretty sure you forgot to inform the American public of that." So again, this is a conference about the real truth about health. Do you see the betrayal here? They're telling people who are depressed they have broken brains. You have to be on the drugs for life. These fix a known pathology. Now, one of the things in our law is that medicine is supposed to be based on informed consent. Informed consent means you have to be honest about what you know about the problem, and you have to be honest about the risks and benefits of whatever the treatment is. This tells you that psychiatry has been practicing for the last 30 years in violation of informed consent standards. And that's what you've seen here in about 25 minutes, I guess. Read this. Because it's collapsing now, psychiatrists, some of them are being asked, well, why did you tell people that? Just read this. Basically, he's saying we lied to patients because it's good for them. And actually, you can see other people. Well, it reduces the stigma, which isn't true, by the way. But that's what they're saying. We knowingly lied because it's good for people. And it's hard to form good medicine when you're lying to people to make but you really see it makes us look better.